When I first started here at Appling, I did not know who Mary Herrington was, but I quickly figured out in our small rural facility that if you called and asked a question, they would say, "I don't know, call Mary Herrington." The qualities that make Mary so unique and the value to the team, she is pretty much the person who can do everything here at our facility.
I was always willing to do anything. I always said, if you need me to help you, call me. Of course, I've been called along the way. My name is Mary Herrington. I work at Appling Healthcare System. I work with the patients and their families from when they come in until either they discharge or something happens to them.
As a leader in our facility, I wish I had 300 Mary Herringtons. Her dedication to the facility, to work with us and for us, and just to drive our mission, just her abilities to know when to step in and to help out.
50 years is a long time. There's been challenging times, there's been achievements, there's been many different role changes, and her resilience through that has all been very encouraging.
She's dedicated, which is clear for her 50 years of service with Appling Healthcare, and she loves her job.
I love being a team member. We're in this together to serve the people, and that is what we want to do.
With Mary being here for over 50 years, this is her family. This is her home. Whatever she's doing, she's still that face, that name that's recognized with Appling Healthcare, and she represents very, very well.
One of the things that I feel like I bring to the table for my colleagues is the knowledge and the compassion that I have for the residents.
Mary not only works in our nursing home, she also works in our accounting department as far as billing for Appling Healthcare. She has a balance because she understands how they affect each other.
There's challenges with both sides to her job, especially the financial side as insurances change day in and day out. Of course, there's challenges with dealing with people, but I think she handles both with a lot of patience, grace, and sympathy.
She understands that if we take care of our residents, if we take care of their families, and we treat them the way that we expect to be treated, that in turn has a return on its investment. And so there's a balance there in how she does that.
The way my Mimi raised me was to treat everyone as if they're my family member. I grew up seeing the way that she treats people, patients, residents, community members. And I feel like that's greatly impacted my practice because I do try to approach every patient as if they are my family member. I think that's a rare quality that we see in healthcare these days.
One thing about Miss Mary that's great is how much she loves her family. Her grandson, Cal, when I started working here at Appling, he worked here as a nurse in our ER.
I feel very lucky that I was raised by her. The only word I have really is love. She just constantly radiates love to everybody. At our house, she has a closet full of gifts that she's always ready to give somebody a gift or just do anything for anyone.
I think some of the favorite things that she likes to bake would be desserts. Red velvet, carrot cake, cookies.
She absolutely adores all of her family, and that's amazing to see love that she has for her family to spill over to the love of her work family here. The value that Mary brings to our community is her relationships with the residents and the residents' family.
They feel more comfortable with someone that they're familiar with, that they know her, they feel like they can talk to her on a personal level and not just a professional level.
It's a tough decision, and Mary walks through that with each and every family that comes into the system.
She makes them feel at ease when it comes time to make that decision to put mom or dad or grandma or grandpa in a skilled nursing facility.
To go out in the community and to hear the people have talked to me and tell me, I was so upset, but when I saw you talked to me the first time, that calmed me, and I knew that everything was going to be all right. It really makes me feel like I'm doing what I feel like I was called to do.
she really does feel like each and every one of those residents there are her family.
If she has intake for a resident, she works with a team to make sure that we're a fit for them and they're a fit for us. Rural healthcare is tough. If you are from here, you believe in the system and you know the importance of having healthcare right here in your own community, she understands that and she helps make other people understand that.
When they come in, the families don't really want to come. Sometimes it's not a choice. And I just want to assure the patients and the families that we're here to take care of the patients, but they will be fine and we will take care of them.
She takes that time to work with the staff to make that determination if we can provide what this patient needs so that the outcome for the patient is what's best.
I am honored. I feel loved by all, and I just can't thank them enough to even think that I deserve to win an award like this. I've worked with some of them so long, they're not only colleagues, they're lifetime friends to me.
It's an honor to work with her and to have her represent our facility.
It's very rare that you see someone dedicate themselves to a career for 50 years. I'm glad that I've got to grow up around her, see her love and support for the community and dedication to the hospital.
I think it's hard to measure the impact that she's had on every person that she's came into contact with. More importantly, you can't teach how to love and serve others the way that she does. She has a servant's heart. I hope that one day I can be just like that.
She loves God and her family, and then next would be Upland Healthcare probably.